especially for those who are coming in March. But I think what is important to talk about this evening is a little bit about sort of the philosophy behind UNDA numbers. Unfortunately, you'll never hear about it in the school. You'll never hear about it because it's perceived to be so-called bastardized homeopathy, which it really isn't, but that's the misconception and misperception that's out there, and people have a perception, and that's kind of what they live with. So it's sort of what it is. It's another avenue of energetic therapy that personally, for the last 15 years that I've done it, I found it to be extremely effective. In fact, it's a hell of a lot easier to use than classical homeopathy, and it can produce pretty outstanding results. Not that classical homeopathy doesn't, which it does. It's just that it's easier. And it's easier, and it doesn't take you 10 hours to repertoire the case. And then figure out you got the wrong remedy. Because the reality is that, yes, it takes study. Yes, it takes a while to learn the numbers, but as opposed to learning 3,000 remedies, you only have 76 remedies to learn. And because it's not based on symptoms, but rather organ systems, it's easier to conceptualize how to sort of mix and match the remedies together. You know, as those of you who heard me talk before, you know, and as we just did in class today, I'm surprised to hear one of the students say that you've never had any type of presentation on what to do in a first visit, which surprised me. It's like, really? You've not been told how to do a first visit? You'd think that would be rather important before you go in the clinic. But anyway, you know, what UNDA numbers are about, in fact, what virtually all our therapies are about, no matter what therapy you choose, is how do you recreate balance in the body? You know, we spend so much time focused on this therapy and that therapy, and we've lost the perception of what are we really trying to do? What is the goal of the achievement? And are we trying to, you know, use coenzyme Q10 because we memorize it's a good remedy for the heart? Are we using coenzyme Q10 because it has specific physiologic actions that will happen to balance the intercellular space and the extracellular space so that the heart muscle and other muscle tissue will function more adequately? So we can either learn it from the physiologic perspective, from the aspect of what are we trying to create from a homeostatic perspective. I prefer to look at health as what types of things can I do that will facilitate based on my understanding of, you know, where the physiology is out of balance. And we, of course, can thank Bernard for, you know, it's too bad that we don't pay more attention to that one saying. It's really what medicine is all about. You know, he wrote it when he died in 1878, is considered the father of physiology. All the vital mechanisms, varied as they are, have only one object, that is preserving the constant conditions of life in the internal environment. That's really what health is, it isn't. That's really every single system we have is about that. How do we preserve balance in all organ systems? And yet we focus so much of our attention on treating a symptom without trying to understand, but where is it coming from? And I think we make many mistakes, unfortunately, in our therapeutic protocols because we focus on the symptom, which can palliate a person, make them feel better. We'll never cure them. And maybe you won't be able to cure them because maybe you'll be at a point where it's not possible. And that's, from a patient's perspective, that is true. From a disease perspective, it's not true. Because because how you cure any disease is to do that. That's what cure means. Every system working in constant balance and in balance with each other. And it's a pretty simple definition of what it is that we're trying to do. How do we preserve it? So, you know, the big talk now in medicine is all about alkaline pH. Oh, everybody's, you know, for chronic disease, everything is acidic, so we'll use alkaline water and we'll do everything we can alkalize. And we'll try and drive your saliva pH down, we'll try and change your urine pH. You're going to do that till the cows come home. Because the body tissues are of all different pHs. You know, the pH in your mouth is different than your stomach, is different than your intestine, and your heart is a different pH. All your tissues have different pHs. So just because you're trying to measure it in the urine and saliva, don't think anything else in the body is listening to that. Why would the hell would we want to alkalize our stomach when it's the most important aspect of digesting most of our proteins and fats? You don't want an alkaline stomach. So what are we trying? We're trying to alkaline. What all we really need to do is how do we get the debris out of the extracellular matrix? We say, well, the reason it's there is because they're too acidic. Well, what are you doing about their amount trees? How are you trying to enhance their amount trees itself, which will facilitate the removal of that? Why don't we have people just say, start walking and get on a mini rebounder every day? It's an excellent way of moving your lymph. And of course, we're so stationary in life now. We live in a very stationary society. We have become sedentary. You know, people just don't do anything. So we have the extreme. If you have to go to the gym 3 or 4 times a week, or we do nothing. And like, there's not a lot of in-between ground. So people think, well, I'm not going to the gym, so I guess I'm not doing anything. And that's unfortunately the bulk of the patient population. Because, you know, we think, well, you ask somebody, do you walk? Oh, to and from the car, does that count? You know, to and from the store, does that count? It's like, well, it counts, but it's not really what we're talking about. And as I mentioned in class a little bit ago, now we see with cancer studies, just moving every hour, just stretching every hour is more beneficial than doing exercise in some cases. So literally getting up from your desk or where you're sitting and stretch and move and change your scenery and change your vision by itself has a tremendous healthy benefit. So we can still go back to doing some of the absolute simplest things to try and maintain and create this internal environment. And of course what the body is constantly doing is it's in this constant balancing act. It's constantly looking at every system. And who's regulating all this? This thing upstairs called the brain. It tries to feed information down to all these different organ systems to try and make sure that everybody's on the same page. The analogy that I come to like and patients seem to get the understanding of is I say, think of all your organ systems as being an instrument in an orchestra. They're all different instruments. Unfortunately, in your body, because you have condition whatever, these instruments are all playing their own tune. And it's terribly out of tune. And it's no wonder you don't feel well. Because imagine listening to some melody and every instrument is playing a different melody. What it would sound like. It would be so distracting to the body that the body really wouldn't have any idea what to do. So the body's attempt when something gets out of balance is to do some type of a creation, and the body has more backup plans than any computer does. You know, when your computer doesn't work, it doesn't work. When the body doesn't work, it says, well, we'll go for plan B. And if plan B doesn't work, we'll try C, D, or E. And it'll keep going, and that's, of course, how we end up creating pathology. Which really isn't pathology. It's a failure of the adaptive physiology that allows this tumor or mass or cardiovascular, whatever it develops, to go out of balance. And of course, we developed in this wide consternation of symptoms that people develop simply because we're not paying attention to the orchestra leader and what's happening to all the organs downstream, or what's happening to the organs, to the instruments that's in the orchestra. I said the goal that we would have is to start to get all these instruments playing the same tune. And if they start playing the same tune, it's going to sound pretty good, and you're going to start to feel better. And at that point, you don't have to worry about your symptoms anymore because your symptoms are not really what we're attempting to deal with anyway. And therefore, disease is really the inability of the body to maintain balance. So we have all these systems, and when one system gets too far out of balance, you can't get it back. So the body reacts in some way. So then we intervene as physicians and say, well, can we force it? Can we force it however we're going to force it? In a natural way? Or can we force it using a pharmaceutical medicine? or homeopathic medicine, or an herbal medicine, or a nutraceutical, or a physical therapy, or bone, or craniosacral, or a flower essence, or an UNDA? Can that recreate this balance? And in the recreation of this balance, are we exceeding the physiologic limit that the body is going to let us go to? And one of the challenges is with both our therapies and pharmaceutical therapy is we often do. We exceed the limit. One of the most common therapies that exceed the limit is IV therapy. IV therapy always exceeds the physiological limit. IV therapy you can't do within physiologic norms because we're basically giving a drug. When you're talking about the doses we're giving a pharmaceutical agent, but it's a vitamin. Well, maybe a vitamin, but it's still a drug. So it has the effect. So you have to, that's why IV therapy is, just IV therapy. You're sick, we'll do a Myers cocktail, we'll do 100 grams of vitamin C because you have cancer, which we know is therapeutically effective. But we also know that it's a drug at that dose. So we need to be compensating for what else is going on so that we don't further imbalance and kill the patient by doing our therapy. It's like, well, it's a subtle therapy. Is 100 grams of vitamin C going to kill somebody? No, it shouldn't. And I don't believe it has, not that I know of, not that there's been any reported cases. But if that's the only thing that we're looking at, I think we're approaching the patient from the wrong aspect because we're trying to force this continuous imbalance into a situation of balance. And you won't be able to do that. At some point, you truly have to use the therapies that are within physiologic limits, that do not exceed the physiologic limits of the cells. You see the physiologic limits of the cells, they sort of are doing this. You do a little too much, and they don't want to do this anymore, they're going to go, and you're going to basically create apoptosis of a healthy cell, which is what, of course, what cancer is trying to do, is trying to blow up all these cancer cells. Using a chemotherapeutic agent or using 100 grams of vitamin C, which in reality is like a chemotherapeutic agent, but with less side effects, and obviously with less nasty side effects. So it was mentioned today that we really have to be thinking about sort of proactive medicine. It's really unfortunate that we spend so much time down here. Why do you think we spend so much time as naturopaths down in this retroactive medicine? Why are we spend? I would bet 90% of your therapies work there. Like, come and see us, okay?
That's what they're expecting?
That's what the patient is expecting. What we're trying to do is we're trying to be mini MDs. Well, they got drugs. We don't like drugs. Not that drugs are bad. We don't like drugs because we hear they have nasty side effects. And we believe that drugs are basically pretty much are suppressive. And we're not supposed to suppress anything. Not realizing that the same remedies we do are just as suppressive. But we don't like to think that our remedies are suppressive because we think they're natural and therefore must be totally safe. They're safe in the right dose, but they're just as nasty as any drug is, or can be. Homeopathy can be as suppressive as chemotherapy, as suppressive as an UNDA can be, as suppressive as an illegal therapy. There isn't any therapy that we use that doesn't have the potential of creating suppression if not used properly. So we have to really understand what it is we're doing. And yes, in my opinion, I think if we got away from this, but we can, of course, we say, well, our patients will never come back because they want their global fix. But if we can teach them the physiology aspects of what they do, and then do therapies that are in the proactive, you get the same effect. And we wouldn't have to spend so much time learning about what do we do for somebody who has disease X. Because we would be able to manage disease X without even treating disease X. But your training, unfortunately, and I was involved in SCNM for 25 years, I was part of it. Just like, learn this stuff because somehow this is what our patients need. And they do need it. But are we the right doctors to deliver it? Or should we really be doing what our real strength is, which is an understanding of the physiology and the biochemistry of how the body works? Because when we approach it from a health model, what we're really trying to do is We're not trying to educate the patient to understand. I mean, that's nice if they do. What we're really trying to do is we're trying to give them enlightened knowledge. But for what purpose? Simply for the purpose that they will now take, I get it. I get that I got to do the work. That it's not up to the doctor. The doctor's role is to facilitate the patient's understanding of the imbalance. At least that's my sense of what it is. And it's not to basically give them something hoping that they react and feel better. They've decided the benefit of the patient taking responsibility is you don't have to carry them around on your shoulder. Because that's what you end up doing. You know, there's very few people in this profession, or in reality, any medical profession, who doesn't deeply care for their patients. I can assure you, there are medical doctors, osteopaths, chiropractors, that cares deeply about their patients as you do. They take great responsibility of what they're doing. They take great care in what they do. They take great love in what they do as they see patients feel better or get better. You can't take on the responsibility of somebody else, unfortunately. They have to be willing to do that so that they will make whatever is necessary for them. And you call it lifestyle, you call it anything you want. But since we have no better word at the moment, the reason that lifestyle is a bad word to most people is because they associate change with what? Change equals
Misery.
restrictions. The common word you'll hear is, oh, that won't be easy. Oh, that's way too hard for me. And I think it's going to be too painful. I don't think I can do that. And you'll hear it a lot. That is up to the patient to make the decision. It's not up to you to make that decision. They may make that decision. And it's like, it's okay if they do. They're maybe not ready yet. But the patient who truly engages in just the true model of medicine will basically start to follow things, and then they don't think about it. They'll look at this treatment plan that has, 15 things on it and said, oh my God, that's way too many things. He said, oh, so you don't want to drink water today. Well, that's one of the things. Well, what about my coffee? Well, that says water. You read coffee in the word water? I mean, I don't see the word coffee there. So what I'm suggesting is you drink water. You don't have to drink water, but you just asked me for my suggestion. I'm not going to tell you what to do, but you paying me for my opinion. I'm going to tell you what my opinion is. You can choose to do it or not do it. It's really not up to me. You really have to, I believe, you have to give the responsibility back to the patient. Some are not ready for it, and you're not the right doctor for them, and that's okay. And they don't have to do it all at once either. People say it's an all or nothing. This isn't all or nothing. You do 1%, you're 1% better than you were last month. You do 1% every month, and you'll eventually get better. If you do 0%, you're never going to get better. So like this is all or nothing. This isn't about all or nothing. Remember, people have their health journey for the rest of their life. We're not seeing patients for a short period of time with the idea that suddenly they won't have a migraine headache, or they won't have premenstrual symptom, or they won't have breast cancer, or whatever it is you're treating them. The whole idea is we treat them as an individual, as a human, with the idea that we are here as true preventive doctors who truly understand health, from the perspective of we can facilitate your role and your understanding at a level that you're comfortable with. I have many patients who I've seen for 20 years in my practice. And I just had 2 of them yesterday. I haven't seen them in Portland, but they're here for a wedding today. So they came early, and they came to the office yesterday. And they've been my patients and the wife had MS, and the gentleman had one of the most challenging stories I've ever heard of any patient, I've heard some pretty wicked stories. And here's 2 people who continue to just ask me things about how do we get better? What can we keep doing for ourselves? That's the level of health where they're at, per se. And it's very exciting when you see people for many, many years. Because first of all, it's a lot easier. And you know that they really appreciate what it is you're doing. So they don't question when you start talking about you know, drinking water or doing castor oil or whatever. So what am I doing this for? But when somebody's been a patient that long, you know, that's the difference between somebody where you're trying to work in an illness model, which is really what our teaching is. We're teaching you an illness model more than a health model, because we have all this idea that, well, if they understand, you know, why they're taking CoQ10, they'll take it. That's what we think. So we're hoping that if they understand, that maybe now they'll take it. But if you look at the statistics, that's not good enough, because they don't take it. Or they take it for a couple of months and say, well, I don't feel any better, so I stopped taking it. I mean, you'll hear the stories over and over, because we basically have our fingers crossed that it'll do something, and somehow they'll recover, and then they'll say, oh, such a great doctor. And then you'll say, oh, whew, that $250,000 was worth it, because they said they felt better. So my ego was okay with that. But it's a nice thing to do, but the reality, that shouldn't be what we're about. It's not about, unfortunately, you have to say it, but it's not about the patient feeling better. It's about the patient understanding their process. Because when they understand the process, they understand that feeling not so good is part of the process. You can't suddenly have disease and it's suddenly gone. There's kind of, they got to the place where they are because of some challenges. In order to get out of that, they're going to have to recycle back through it. There's going to be some challenges. So don't feel badly, or you shouldn't feel badly, at least I don't feel badly. I mean, yes, you have empathy. But you know, if somebody comes in and says, I'm still having migraine headaches, you say, I know you're having migraine headaches because I'm not treating migraine headaches. That's not what we're treating. We're treating you as an individual to try and recreate the homeostasis and physiology so one day you won't ever have a migraine headache. And I say that every time as we have to. And some will say, forget it. You don't know what the hell you're doing, and I'm leaving, which they do. Or they'll say, I get it. There's no sense just keep taking Advil because I don't have an Advil deficiency. So that's not why I got the headache. So, you know, somewhere in between there is this aspect of what are we doing as a physician? And I know I'm in a much better position than you are, but you'll start a practice. If someone doesn't come back, it's like, it's okay. I mean, I don't really need you as a patient, to be honest with you. You need them as a patient because you got this big bill to pay called a loan. So you're going to be a little more anxious to try and do this. And it's not bad, just don't compromise your belief system. We're not asking, you never have to compromise your belief system. You want to practice from your true state of integrity with high ethical understanding of it, but also don't get frustrated if you have a bunch of patients who don't come back because they're not better. They're just not ready for what you got, unfortunately. But it doesn't mean you don't keep sort of working at them. So we look at, why does somebody get sick? And the most common reason why people get sick, we did a survey. If you go ahead and do it with your frustration survey, we're not going to ask you to do this, but if you did, add another question, and we'll talk about tomorrow in class, and say, why do you think people get sick? Which of those is the most common answer that you would get, that people would tell you? Number 6, by far. Because it is by far the most common reason, because it's all about that damn daycare. That their kid always brings it home in their backpack, and then they dump it on the floor, and then I got sick. And I hear it so many thousands of times. It's like, you just carry these bugs home. And it's true, in a daycare, one kid's sick, they're all sick. So they say, well, I guess the rest of us are getting sick too. So the belief is, the germ theory is true. So that's what they believe. That it's because of the bug I got sick. But it's not because of the bug you got sick. It's because your terrain was out of balance, and your own terrain was not able to withstand the microbe. So germ theory says, and with Koch's postulates, if you inject microbe X into 50 mice should get sick. What if only 49 of them get sick? Is that still a disease? They didn't all get sick. But his postulate said they have to get sick because it's the microbe. That's what the germ theory is. So you inject 100 individuals, and 100 individuals won't get sick. Why not? Even though the germ if it's a physiologically high enough dose, should make you sick. Because everybody has a different terrain. So we spend more interest, maybe we don't, but certainly the medical profession does, on the bug. The whole thing with Lyme disease, so much bloody information on the bug. It's not about the bug. You can take antibiotics up to yin yang. And we've had people who've been taking them for 15 years and they still got the bug. Maybe the antibiotics don't work. You figure? After 15 years, probably something else is a problem. But they say we don't know what else to do because it's still a bug. It's not about the bug. It's about understanding the physiology and the homeostasis of the patient. So none of those are really the cause because they're only triggers. Because the real problem is this. That's the problem. We live in a society that never follows natural laws. Why? Because it hurts. It's no fun. It's not like those Viagra commercials. Doing a castor oil pack is nowhere near as fun as what looks like in that Viagra commercial. That looks a hell of a lot more fun than a castor oil pack. Annie will tell you that. So it's like, how do you make a castor oil pack sexy? It's like, it's not easy. Like, you haven't seen any commercials, somebody doing castor oil packs. It's that aspect. We constantly violate nature's laws. And then we're taking this round peg, trying to force it through a square peg through the round hole. I wonder why we can't get the peg through the hole. Because they still are not following natural laws. They still are constantly violating natural laws. And it's really difficult to get somebody cured who doesn't follow natural laws. What's a natural law? You need to sleep. How much sleep do you need? 7.5 to 8.5. But the patient says, "You're kidding, I'm wasting half my day. I do just great on 5. You can't tell me to sleep 7 hours. Of course, you can do that for a while, but your physiology doesn't know that. Well, you ever wonder why you break down? You only sleep for 5 hours? There's a reason there. There's a reason you need 7.5 hours. It's because you need to physiologically rest your biochemistry. What's another natural law? Water. Like, really? The water in Phoenix sucks. It's terrible. So yeah, well, then you better buy a filter. Because don't drink that stuff out of the tap, because it really does taste like crap. Nobody wants to drink it, but yet they'll put it in their coffee. Like, and you're drinking that terrible water. It's like, don't drink that water. So anyway, you get the idea. So, we look at this really recent publication in 1882 that basically said, this is the reason people got sick. It's the same reason they get sick now. It's only written 140 years ago. So, diet, indoor, outdoor gymnastics. My God, they had gyms. They had 24-hour fitness in those days. Who ever knew? Clothing, sleep, recreation, and hygiene. Which we basically just correlate to everything that we do today. It's no different. The 1800s is no different than the 1900s and 2014. The same reasons they got sick then are the same reasons we still get sick, because we still violate natural laws. They violated natural laws in those days. If you look at some of the, including Hahnemann and these all the great composers and stuff, they were alcoholics. They smoked cigars every day. They lived in moldy basements. They had coal burning right beside them. They had this terrible air quality. It's like, that's pretty stressful on the body. But some of them still lived a long time.